All right, thank you everyone for joining this month's Davis Links Resource Forum. The topic today is maternal health, which we know is an important topic and something that has been a gap identified in our community. So we're excited to have a variety of speakers today. I'm going to go ahead and host, and let's see here, let's jump in. I just want to bring up before the presenters talk, Sabrina later is going to give an overview of maternal health, by the way, what it is and yeah, how that looks like in Davis County and then the resources she offers. But I'll just bring stuff up just in case we are running short on time in the end of the forum. So just wanted to start off with announcements and upcoming events, and then we'll have our resource presenters, and then we'll end with final questions and then an evaluation. As always, we want to make sure that we're capturing what you want to see in the forums and what you enjoyed. Okay, so with the Davis Links announcements, and by the way, these slides will be available and will be sent out after this presentation, probably around Thursday or Friday, along with the other presentation materials. But anyway, just on this slide, you are able to go to the community announcements folders. Community announcements folder. I am going to show you on davislinks.org, which is the website where the resource forums, the resource directory, and other things are located. If you go up here to the top, and then let me scroll. Oh, okay, there we go. I think it's working now. So or up at the top in the navigation, there's the community announcements tab. If you click on that and then access community flyers, you will be taken to a drive that anybody can access. So this is a review for many of you, but just want to let you know it's here. We have almost 100 flyers up to date. We keep them up to date of community events, programs that exist in the county, things like tax assistance, which we know is something that people need right now, things like food assistance. We've got Breezy Babies, who's here today presenting. So some of it is more programmatic and ongoing, and some of it is like a definite to things, but things for older adults, volunteer opportunities, support groups, and many more things, job fairs. So we try and keep those up to date. If you would like to send any materials for us to put in this community announcements folder, you can let me know, or you can go to or email davislinks@daviscountyutah.gov. Another way also is to go back to the Davis Links site. Okay, and down at the bottom and anywhere on the site, you can share a message and send an email that way. Okay, let me go back. And then another thing is, so as far as upcoming events, next forum for this resource forum is Tuesday, April 28th from 9 to 10:30. The topic is child care support, which is a good follow-up to the topic today, and it will also be virtual. You should have received a calendar invite if you are part of the email list, and if you aren't on the email list, you can also let me know or go down at the bottom of the website to be able to sign up for that. And then the Davis for Health Steering Committee, Davis for Health being the county's health improvement collaborative, is going to be meeting Wednesday, April 29th from 9 to 11 at the new Davis County Health Department Health Annex building. For those of you who knew about Tully Event Center, the health department has now purchased that building, and we are calling it the Annex building. So that's in person, and to receive a calendar invite, you can email Isa at co.davis.ut.us. So like I said, these slides are going to be made available afterwards. I also just want to show you where you can find a quick link in the resource directory for things such as maternal health. This is new. This is a new thing in davislinks.org. So let me go there. There's a lot of navigating. We go back to the home page and we go underneath the search bar, which already was there. There's different topics here, maternal health being one of them. When I click on the link, I am taken to going to take a second. Okay. And by the way, all of our presenters programs are represented here, but this is the resource directory itself. And you can see about, I think, 40 different programs that are mostly local, fulfilling a need. And so anyway, that's a quick way for you to find things related to topics. So we want to make it as easy for people to access the resources, and you are able to share this to anybody you would like. You can even send it in a different language, or the language of recipient, both as an email and as a text. And anyway, so this is just a way for you to quickly navigate many resources for, let's say, in this instance, maternal health. Okay. With all of that, I am going to turn it over to Sabrina and Emily to present, give us an overview and talk about their programs at the Davis County Health Department. So let's start. And by the way, each presenter will have about 15 minutes or so, and then you as the audience can ask questions for about 2 minutes, and then we'll move on. Okay, Sabrina, take it away.
Okay, thanks, Travis. Good morning, everyone. My name is Sabrina Harmon, and I'm the Director of Family Health at the Davis County Health Department. And I am grateful for this opportunity to talk to you all today about maternal health and kind of how that looks in Davis County, and then some of the things the health department does in this realm. Next slide. So just real quick, one definition, there are many definitions of this, but a good way to think about maternal health is that it refers to a woman's physical, emotional, and mental well-being during pregnancy, childbirth, and the postpartum period. And this topic is incredibly important because maternal health is really what helps reduce preventable deaths and complications during this time in somebody's life, but ensuring maternal health also supports families and healthy child development and improves stability of families. And so that's why this is such an important topic, because it's very upstream work that affects all of us long term and really helps us have healthy and thriving families, and particularly in Davis County, which is where I do my work, and many of you probably do your work, just really important. And as Travis mentioned already, Davis County maternal health resources have been recognized as an overall gap for Davis County. And so again, very thankful for this opportunity to present to Davis Links so we can all share what resources we have and what work we're doing, and move this important work forward. The next slide. So I just wanted to share a few slides of what different maternal health things look like. So this in Davis County specifically. So this is maternal mental health. So 2 in 5 women in Utah experience anxiety in the 3 months before a pregnancy. So in Davis County, that would account for almost 2,000 women. And then for anxiety during pregnancy, that would be about 1,700 Davis County women. So a good portion of people in our county have experienced anxiety or depression, as we'll see below, but these things are really something that affect quite a few women in Davis County. So 1,100 women experience depression before conception, 1,100 will experience depression during their pregnancy, and 688 women will experience postpartum depression. And my guess is these estimates are very low because sometimes people aren't seeking help or don't know that they're experiencing anxiety or depression. And so these numbers are probably very low estimates, but just so you know, it does affect a good portion of people. So next slide. Maternal mortality rate between 2005 and 2024, there were about 110,000 live births in our county. So that means that we would have an estimate of about 18 maternal deaths. And all of these deaths are unnecessary, in my opinion, as a nurse. And so Utah does rank very low in maternal mortality rates, which is great. We're fourth in the nation. So we're doing good work, but again, 18 deaths are unnecessary. And so just another thing to have top of mind of how we can support mothers during this period of time. Next slide. So that's just basic Davis County information and kind of introducing the topic of what maternal health is. I'm going to turn some time over now to Emily Chowan. She's the community health educator in my division, and she's going to talk a little bit about the different programs Davis County Health Department has that support maternal health and families. And then we will have time for questions. So we don't have very much to present today, but I'm excited to tell you about our programs and how they support families in Davis County.
Yeah, thank you, Sabrina. So just like she said, maternal health, it supports not only mom, but it also supports healthy child development and improves family stability as well. So all of our programs do that. So we're really excited to share them with you, and then hopefully you can share them with people in your circles as well. So the first one is this Connection Visits program, also known as our home visiting. You've probably heard of home visiting before, but we like to call it our Connection Visits program. And it's available to all families in Davis County that have kids that are 0 to 8 years of age. So there's no insurance requirements, income requirements. We don't look at any of that. They just have to live in Davis County and they can use this. And we have nurses who do these connection visits that are free, and they are able to help families with a whole bunch of different things. There's a list there, but it goes beyond that as well. So not only understanding child's health and development, answering parenting questions, referring them to different resources, help with so many things. They can do developmental screenings, and we usually do that on all kids. And then also postpartum depression screenings as well is a big part of it. And so that's a big way where we can help support mom's maternal mental health. And then we can also refer to other programs, other resources that they might need that might help. And so this program is awesome. I have the privilege of meeting in the community with people in Davis County, with moms, and telling them about these programs. It's part of my job, and I have been able to hear how this program has helped so many moms. A couple weeks ago, I had a mom tell me that she set up an appointment with the nurse, and she wasn't really sure what she needed help with. There wasn't like anything in particular. She just wanted to talk to an adult, and I think that's huge. And I like that our program, it's called Connection Visits, because I think that connection piece is so important. And so she was able to meet with the nurse, talk with her about things that are going on in her life. And then she was able to find resources that she didn't even know she needed for childcare and for different activities for kids. And so it just shows how important this program is for everyone, not just people who might have a specific program. We can help those people too, but being able to help everyone in the community And again, there's no income requirements. So even families who maybe make a lot can use this program as well. And so, yeah, this is an awesome program, and I hope you're able to share it with the people that you come across. And if you'll go to the next slide, this just has all of our contact information of how to get a hold of us, of how to find the program. So we have our referral link. So if you want to refer a family to this program, you can use that link or that QR code. And then requesting an appointment. So if a family wants to request an appointment with a nurse, they'll use that link. And then we have our website too that has more information if you'd like more information. I also have these, if you'll go back, sorry, the tear off. If you have a space where you can hang these up, I am more than happy to deliver them to you just to get the word out about this program and to help more families. You can go to the next slide. Okay, another program that we have here at the health department is WIC. So this is our nutrition program for women, infants, and children. So this helps pregnant, postpartum women, and then also children up until age 5. This one, they do have to qualify with their income, or if they're on Medicaid or food stamps, they automatically qualify. So this program helps support families with nutrition, so getting healthy foods and formula. But not only that, WIC also helps with nutrition education, counseling, help with diapers, breastfeeding support, and then connection to referrals and resources. And so this program is also really, really helpful for women. Money and the price of everything right now, price of food is very expensive. And so having this program to be able to support in that way, to be able to relieve some of that stress on a mom is incredibly helpful. And so, yeah, this program is amazing. Not only that, but breastfeeding support as well. Being able to have someone to connect to. Breastfeeding can be really hard and stressful on a mom. And so having that support and having a lactation consultant that is available to them for free is an amazing resource as well. So this program supports kids. I think a lot of us think WIC helps kids, but it also helps pregnant and postpartum women as well. And then the nutrition assistants are able to, and the dietitians are able to help with the maternal health as well. So if you go to the next slide, this is how clients can request an appointment. So they can call or text that number or go to the website as well. And then I have flyers that I can bring to you if you have a space where you can hang them up, or if you want to give them out to people that you work with. I'm more than happy to give those to you. And I'll turn the time back over to Sabrina.
Okay, thanks, Emily. Real fast, Travis, I think we skipped over the breastfeeding slide. You don't need to go back, but I just wanted to also mention, as Emily talked about supporting breastfeeding. So we know that breastfeeding helps both moms and babies if someone chooses to breastfeed their baby. And so WIC is a great way to help support that. We also know that 6 in 10 women stop breastfeeding sooner than they would like to for a multitude of reasons, returning to work or difficulties or time. And so WIC is a great resource to help those moms with their breastfeeding goals. And I am very proud of our WIC clinic. They do great work, but last year we received the Breastfeeding Gold Award of Excellence from the USDA. We're the only clinic in Utah, the only WIC clinic in Utah to receive that. And so they do wonderful work surrounding breastfeeding and helping moms achieve their goals. So grateful for that work as well. Next, we'll talk about immunization. So immunizations clinic is also part of my division, and how that supports maternal health is vaccines during pregnancy are very important. Many vaccines can be given during pregnancy that support mom's health, but also pass immunity on to their infant. So we do those vaccines here in our clinic, but in addition, we are a full service vaccine clinic. So infant immunizations, back to school vaccines, the vaccines during pregnancy, as we mentioned, senior vaccinations or adult vaccinations, seasonal and travel vaccines. Another key point of keeping moms and babies healthy is oftentimes family members who are visiting new babies will also need to be up to date on their Tdap vaccine. So that's the one that contains the pertussis component of the vaccine for whooping cough. So just another thing to highlight is that if people are interested in being up to date on their vaccinations, if that's what's right for them, our clinic can also support them in that way. So next slide. And here is the information for being able to get an appointment for our immunizations clinic as well. You can call or text that number or visit our website to schedule online. And I think if you go to the next slide, oh, we have one more thing to say. So every year, our division does an annual report where we talk about the work we're doing and what the community outlook for Davis County looks in different areas. Here is a link to access all of the annual reports for the health department. They're full of great information and wonderful work that's happening in our community. So if you would like to take a look at those, there's the link to do so. And yeah, it's worth looking at, and a lot of work goes into these reports. So I always like to say, please look at them, but you'll find some really interesting information and really great work that's going on in Davis County. So next slide. I think that's all we have. We have time for questions, and thank you so much for your time and letting us present today. And for each of our presenters, thank you for telling more information about your programs and the important work surrounding this very meaningful topic. Thanks, everyone.
Thank you, Sabrina. That was really good information. We don't have any questions on the chat, but I thought somebody raised their hand. I don't know if they by mistake were trying to do something else, but I don't see any hands anymore. Any questions from anyone? Dolores?
Yes, thank you. I would like to know how many visits can a mother schedule with the nurses?
Yeah, that's the great thing. We will visit with them as many times as they need. Oftentimes during these visits, we identify so many needs, and rather than overwhelming parents with oh, go and do these 20 things or these 40 things that you need, we make small actionable steps in a care plan with them. So we might say, this week, I want you to make an appointment with WIC, and leave it at that, because that may be all that the mom can handle at this time. And then we circle back with them the following week and say, were you able to make the appointment with WIC? When are you scheduled? How did it go? And then we move to the next step. So families can have as many visits as needed. Further, if we meet with them and they don't have any needs, we always tell them, as things come up, reach out. We can come back and visit you at any time. So the answer is as many as the family needs, and then it doesn't have to be ongoing. It can be as needed as well.
Thank you, Sabrina. Ms. Betty, you also have your hand up.
Yes, I was wondering when you were talking about your data, if you're seeing, are you collecting information on racial and ethnic moms and families? And if so, are you seeing any challenges or needs that are going unmet or specific to that population?
So I had one of our epidemiologists help put that together. I'm pulling up her sheet. So the thing with this data is it lags by many, many years. And so we're looking at 2022 data with the information that I shared with you today. And I think she was looking just Davis County as a whole. However, we certainly can look at that information and get it out to the group. And I think that there are certain areas where we do know there are disparities amongst certain groups. And we do try to reach those groups through our programs by different events that we know are happening in the community. But we're always looking to partner with community health workers and people who are working with specific groups so that we have a better connection with them. So we certainly can look at that data. I don't have it right now. She didn't break it down by race and ethnicity, but something that I know our I think our community health assessment probably definitely looks at that. Travis could probably speak more to that. And so I think the data is available and we can get it out to people.
Thank you.
I have
Go
a
ahead.
question piggybacking right off of that. I just wondered, as far as families that are reaching out that have children with additional needs or differences or neurobiological situations, as well as parents in those circumstances, if that's something that's being tabulated or, referenced as far as who is reaching out.
Yeah, we do keep record of how many people we do children with special health care needs, and then how many referrals we make for different types of testing or early intervention and things of that nature. Those are all in our annual report, and so we could give you some brief information on that if Emily could quickly pull that up. But we do see a good portion of families not knowing where to turn or how to access help with behavioral issues with their children. And so we're often a first point of contact when we're doing some developmental screenings to help families access early intervention or other services because they are uncertain where to start. And so we do see that very frequently.
Thank you. Great job.
I just put in the chat the link to the most recent Davis for Health Community Health Assessment that the health department leads, but also works heavily with partners on, cha.davisforhealth.org. So you can visit that. That's the most recent breakdown by race and ethnicity that I am aware of, on my end. And so Sabrina may have additional information, like she said, with the epidemiologist, but we are planning on our next community health assessment iteration. So more information to come about that, but that should be released. I think it's in 2028, but we'll have wrapped up most of the information by around early next year. Okay. All right, we're going to move forward, and thank you everyone for the good questions. And thank you again for presenting. So I am going to stop sharing, and do we have, it looks like we do have her. So we are going to, Betty just put something in the chat as well. So thank you. I'll look at that in a second. But we have Bonnie, who is going to be representing Davis County midwives. We wanted to provide a unique perspective that way. They're an invaluable resource also to the community, both midwives and doulas. And you will find in that maternal health folder that I shared with you from davisleague.org a lot of these great resources. So Bonnie, if you want me to pull up, or you can pull up the slides, either way works for me.
I'll have you go ahead and present and advance the slides. Thank you.
Okay, perfect. Let me pull that up then. Great.
Travis, while you're doing that, maybe I'll just kind of give a brief overview. Like you said, my name is Bonnie Baker, and I am the owner of Davis County Doulas and Davis County Midwives. I am a midwife, and I was a doula for, since 2014. And so I wanted to talk on how out-of-hospital birth, specifically out-of-hospital, in the out-of-hospital setting, how community midwifery strengthens maternal health. So go ahead. Quote here saying that maternal health isn't just about surviving birth. It's how a person is supported, seen, and cared for before, during, and after it. And that's one of the pillars of midwifery care. Go ahead. The out-of-hospital birth report from 2016 to 2021 it's a Utah out-of-hospital birth report. The state of Utah puts out these reports intermittently. There's been 3 done since its creation. And the most recent one showed that out-of-hospital births or community births increased from 43% in 2016 from 3.5 up to 5% in 2021. We definitely saw a huge shift of people moving from the hospital setting to a community birth setting during COVID. And that definitely was reflected in that, and it has continued to increase since then. Utah's home birth rate was in the top 5 states in the nation. So we have a lot of babies being born, and a lot of them are actually born at home or in birth centers like ours. During the 12 years covered by the 3 reports that have occurred, the number of women who attempted a vaginal birth after a prior cesarean or a VBAC in the out-of-hospital setting increased from 1.4 to 5%. This is included because it is reducing the rates of cesarean section are vital in improving maternal outcomes. The overall intrapartum or during labor but before delivery maternal transfer rate, so that's where a client moves from the out-of-hospital setting into the hospital, was 10%. The majority of those transfers during labor still resulted in a vaginal delivery once they arrived at the hospital. So 66% of women still had a vaginal delivery. Go ahead. So we talk about the out-of-hospital birth report and those statistics because the US has the highest maternal mortality rate among developed countries. And the disparities are racial, socioeconomic, and geographic. We spend the most amount on our healthcare system, and yet we are still the worst in mortality rates. There are many complications that are preventable with relational continuous care or care that midwifery is based on. And unfortunately, we are the only developed country where maternal mortality rate rose significantly in recent decades. The out-of-hospital or community-based midwifery setting offers a model that directly addresses the gaps of care that these issues are directly linked to. Go ahead. So what is community midwifery? A lot of times people are unclear as to what a midwife is. A midwife is not a doctor. We provide similar care as to what an OB does. We just do not do anything surgical. Specifically out of hospital midwives, we are CPMs or direct entry midwives. There are in-hospital midwives who are certified nurse midwives, and there's some differences, and mostly it's the setting and the ability for prescriptive services. Community midwives provide care in home and birth center settings, and we focus on physiologic birth, informed consent, continuity of care, risk screening and appropriate transfer, and it is intentional, skilled, risk-aware care in the community setting. It's important to note that nations with the best infant and maternal outcomes have strong midwifery-led care. Go ahead. So I want to talk a little bit about how the core ways community midwifery supports maternal health. Go ahead. So first one is the continuity of care. The same provider or provider group throughout pregnancy, birth, and postpartum. My birth center, we have 3 midwives that they rotate through, and 2 out of the 3 midwives attend their birth. They see us throughout pregnancy, their prenatal visits, and then also they see us as well for postpartum. It allows us to build trust, which we're able to find earlier issues earlier because we have a stronger relationship with us, and they're more likely to disclose concerns because it's a more like friendly, comfortable experience. It helps reduce stress on our clients. We're able to better adhere to their birth plans and their care plans, and we know that continuity of care improves outcomes overall. Go ahead. We also focus, oh, whoops, back up one more. There you go, thank you. We also focus on time and relationship-based care. So our visits are longer, about 30 to 60 minutes, depending on the type of appointment, versus a 10 to 15-minute appointment in a hospital provider setting. It allows space for us to really do deep dives in nutrition, mental health, social determinants, and then educate them on the birth process. It allows us to identify cases of anemia, which create a whole separate host of problems that can contribute to complications in the pregnancy and postpartum period. It allows us to identify maternal mental health concerns and if there is the possibility of an unsafe domestic relationship. And we strive to be proactive rather than reactive, which means we want to see something before at the beginning, before it's a huge problem later down the line that we have to really increase services for. We want to nip it in the bud, so to speak. Okay, go ahead. So out of hospital community midwifery care supports physiological birth. Our clients do not have an option for an epidural at home or in the birth center setting, and it's something that they are intentionally choosing. It protects normal birth process, allows for mobility, spontaneous pushing, and lower intervention rates, which in turn lowers the rate of cesarean section, induction, and complications, and then obviously epidural use. And it matters because fewer interventions equal fewer complications, and fewer complications equals better maternal morbidity and mortality outcomes. It also allows for faster recovery and long-term health overall. Go ahead. We also focus on maternal autonomy and informed consent. The client is always the active decision maker in our team. We are a team, and we're giving true informed consent. It's a conversation that starts in pregnancy before we ever get to, the birth process. It's not just a quick signature sign here saying that we can treat you. This allows for reduced trauma, increased satisfaction in their birth experience, and a better psychological outcome postpartum, because mental health is maternal health. Go ahead. One of our strongest core values is postpartum care that actually exists. So in an out-of-hospital setting, clients get postpartum care for the first 6 weeks. That looks like a visit in their home 24 to 48 hours after the baby is born, 1 week after the baby is born, 2 weeks after the baby is born, 1 month after the baby is born, and then 6 weeks after the baby is born. The majority of these appointments are in-home care. Honestly, I call it in-bed care, because most of the time the mom and the baby they're sitting in their bed, resting and recovering together, and we are just doing bedside care for them. We focus on monitoring bleeding, making sure that breastfeeding is going well, and if we spot any signs, we refer to lactation consultants. We check on their mental health and make sure that the family is adjusting well and that they have the support that they need from their community and their family. It helps us to identify postpartum complications such as hemorrhaging and depression and anxiety. And moms have stronger breastfeeding outcomes when they have this support postpartum. Go ahead. Not everyone is a good candidate for an out-of-hospital birth. We are low risk, low intervention. So if someone comes to us who already has some morbidities that disqualify them from an out-of-hospital setting, we can't take them. There are restrictions on our licensure that allow us to take certain pregnancies and certain clients. So there is clear criteria and also ongoing assessment throughout pregnancy to make sure that they not only start out as a good candidate, but remain a good candidate. And it's not just about, safety is not just about location alone, it's about risk selection and system integration, because we're grateful for the hospitals when we need them. We have really good reciprocal relationships with the University of Utah Hospital, as well as Layton Hospital, Intermountain Layton Hospital is also a really great one that integrates an out-of-hospital support if we have to bring our clients in. They're great that way. Go ahead. So the goal for an out-of-hospital midwife is not to avoid the system, it's to use it appropriately. A community midwife or an out-of-hospital midwife is trained in neonatal resuscitation and CPR and basic life support. We carry equipment for birth. If we need to do IVs, we carry medication for hemorrhaging, antibiotics, newborn medication, and we have strict transfer protocols so that we know when we need to go, so that we can have safe, positive outcomes. Go ahead. And then lastly, I just want to share my call to action that when we invest in models of care that prioritize time, relationship, autonomy, and physiology, we don't just change birth, we change maternal health outcomes. So ways that we can do this is integrating midwifery care into broader systems, expanding access to out-of-hospital care, and respect the client's choice in their birth setting. So that is me. Thank you.
Anybody have any questions for Bonnie?
There are no questions on the chat.
Just want to say appreciate the work of midwives and doulas in meeting critical needs. And like I mentioned, that folder that I showed on davislinks.org, the maternal health does have both the Davis County doulas and midwives as program cards in there, as well as directories for other midwives and doulas that serve our area and the surrounding area. So again, thank you for presenting. So, oh yeah, was someone else going to say something? Oh, Rabani, was that you? Oh, I don't know. Okay, we will go ahead and move on to our next presenter, which is Karen Martin with Head Start. So I'm going to pull up her slides right now. And we should be good to go, Karen.
Hi, everybody. I'm so happy to be here. And for those that don't know me, like Travis said, my name is Karen Martin, and I oversee health services for our Davis School District Head Start, Early Head Start, and Title I preschool programs, which includes home visiting. So I'm going to talk a little bit about home visiting and then some of the services that we offer. And some of you that do know me know that maternal health is a very dear topic to my heart. I've witnessed and heard so many issues surrounding disparities and you know, problematic issues in not only our state, but also in other states in the country. So anytime I get an opportunity to talk about maternal health intervention, I appreciate it. So I just wanted to start by mentioning our Davis County Home Visiting Collaborative. And just a disclaimer, this is a fairly new collaborative. I'll give you a little overview of how this started. You all heard from Sabrina earlier, and Sabrina and I were talking last year and talking about the various services, home visiting services in our county, and wanted to find a way to bring everybody together so that we could build relationships and put forth an effort of bringing these programs together so that we know what each other offers and we can best serve the families in our county. And you know, we're hoping that it grows and that it evolves into something more, but for now it's a beautiful relationship between our home visiting programs. But part of some of those programs that are participating right now is the health department with the connection visits, Prevent Child Abuse Utah, has participated. The Utah Department of Health and Human Services Intensive Care Coordination has participated. Hill Air Force Base has a new parent support program that has been very active in our collaborative. We've had Davis Early Intervention, the Weber State University Family Literacy Program, Help Me Grow, and the Davis Community Learning Center with their Baby and You program has also participated. But we've invited others, and if you want to participate, we would love to have you. I've got my contact information in some slides at the end. Next slide. So the purpose of our collaborative was, like I said, to bring us all together. We wanted this strong, unified network of home visiting programs to help build connections with our families in Davis County. We all offer comprehensive services, so we wanted to know what everybody was offering. And there's services like parent education, developmental screenings, health education. All of us are connecting all the families to resources. And like Sabrina and Emily mentioned, a lot of that is just support for the caregiver. A lot of times all they need is somebody to connect with and talk to. We wanted to make sure that these services are accessible to everybody, regardless of, their background, where they live, what they've had access to in, their previous life. We just wanted to be able to make sure that all families in Davis County have some access to services like these. We've also done some professional development with our group, and we've been able to get better coordination and referrals, and then just be able to reach out to each other effectively. So we've started a directory that lists all our programs and what we offer, and we did a gap analysis that kind of helped us recognize and identify some of the gaps that do exist out there in regards to home visiting. Next slide. So I just wanted to throw out some Utah statistics on home visiting. Utah conducted, and this is in 2025, the National Center on Home Visiting compiled some of the programs. So this doesn't include all the programs, but some of the larger programs in our state conducted over 18,000 home visits in 2025. But they estimate that there's over 209,000 pregnant women and families with children under 6 that could benefit from home visiting in Utah. And out of those families, 36% of families meet priority criteria like low income or young mothers, highlighting those needs for intervention. And Davis County is one of the largest counties in our state. So you can imagine how many families in Davis County alone could benefit from home visiting services. Next slide. So supporting maternal health, obviously home visiting is a direct intervention, maternal health intervention. And part of that work that we do, is, like I said before, making sure that every family has access to somebody that they can connect with and come to their home and help them with resources and help them with, building their toolbox. And like Emily said, it directly impacts those children. And that's our goal. Next slide. So just a quick overview of the maternal health services that we offer at Davis Head Start. We do offer prenatal education, prenatal and postpartum education. We have through our home visiting services. We have parenting resources, so a ton of tools and useful help for parents that are struggling in the home or even in our classrooms. We do offer center-based services as well. So health screenings, we have all of our families are assisted with getting their children child exams, dental exams. We offer hearing and vision screenings to make sure that we are catching any early onset interventions that are needed. And then we also offer family goal planning. Next slide. So as I mentioned, our program does offer center-based services as well as home visiting services. So I just wanted to throw that out there that along with the home visiting for our families that are pregnant or have children 0 to 3 years old, we do have center-based care as well. Some of our classes are full day and some of them are half day. And then next slide. I just wanted to show you our recruiting flyer, which has our QR code, website, all the information for our programs. And then on the last slide is my contact information. If anybody has questions, our website is also there.
There are no questions on the chat.
Yes.
Anyone? No questions on the chat.
Oh, no questions.
No.
And I talk really fast, and so I tend to leave things out. So please reach out if you have questions. But yeah.
Any questions for Karen? Thank you so much for presenting. It's so heartwarming to see all the collaboration that's happening in Davis County regarding home visiting. It is an important space, and we appreciate everyone for working together. It can be easy, right, to get into the mindset of program-based thinking, where it's just the individual organization, but that collaboration is so important, and that system-wide approach to address maternal health outcomes. So again, thank you, Karen. Now we are going to go ahead and hear from Candace Ellis, who's with Breezy Babies. Candace, I know that we had said that you were going to pull up the slides. I can do it either. I have it up on my end, so whatever works for you.
Okay. Let me give it a try
Okay.
and see if I can get it. And
Okay. I know Google Meet for some people like, okay, if I weren't using it. Okay, perfect.
okay, let me see if I can get it into my slideshow view. Okay, how does that look for you?
Looks great.
That looks okay. All right, perfect. Yes, my name is Candace Ellis, and I am so happy to be here to present with you. It's nice that we're all on the same page today. We've talked about maternal health and we've talked about this collaboration, and I just love this idea, and I think that is what is going to help better maternal health is this collaboration that we're working on today. So today I'm going to be talking about the roles of IBCLCs in improving maternal health and how collaborative community-based care can positively impact outcomes for both the mother and infant. My objective today is to help connect women and families with resources in their communities that will help support maternal health. And I think improving maternal health requires a shift toward collaborative preventative care. As IBCLCs, we have the opportunity to be leaders in this space, supporting families and partnering with providers and advocating for accessible care. So this is a little bit about who we are. Breezy Babies is the name of the team that I work with. We are a team of 24 IBCLCs, and we live all over the United States. Each member of our team brings a valuable experience to maternal health care. For those that are not sure what these initials stand for, the initials IBCLC stand for International Board Certified Lactation Consultant, and it is considered the gold standard of lactation care. Becoming an International Board Certified Lactation Consultant takes a lot of time and dedication. There are 14 health science credit requirements. There's many lactation hours and mentored clinical hours. After finishing these steps, we then qualify to sit for an extensive strategic exam. After the exam is passed, we are required to meet yearly education requirements that keep us up to date and informed with new research advances. So over here, Brianne Taggart is our owner. We call her Bree, and she is kind of the mastermind of our team. And then you'll see a couple of other teammates that we have, but really there are many located in the Salt Lake and surrounding areas near Davis County. As well as being lactation consultants, our team consists of nurses, midwives, dietitians, childbirth educators, and lots of other specialties that help our team for families with more than just the basic needs. We do accept many insurances, and we have team players that are always actively trying to improve our insurance coverage. And we also do provide self-pay options. Our team is full of lots of different availability options as well. There are consultants that work only during weekends, and some work exclusively on weeknights. And we have others that have very flexible shifts in their work so that they can help many families in different scenarios with any type of needs that they may have. So we talked a little bit about what maternal health means, and I loved the words that were used earlier about this family stability that we're looking for. Maternal health refers to health of women during pregnancy, childbirth, and the postpartum period. And we know that this time in the life of a woman is a significant part of her health journey, both physically and mentally. While much attention is often placed on pregnancy and birth, the postpartum period is equally critical. During this time, many women face strenuous physical recovery, loss of routine and sleep habits, hormonal changes, and emotional adjustments, all of which can significantly impact their long-term health. Maternal health outcomes in the United States continue to be a concern. Many complications such as postpartum depression and anxiety, hypertension, cancer, and many other health concerns can be improved with early support and intervention. Prenatal education and breastfeeding are early protective factors that are intrinsically linked to maternal long-term health. This is just a little bit about what the research is saying. It shows that when breastfeeding goals are met, mothers experience improved health outcomes. Some of these include reduced risk of type 2 diabetes, reduced risk of cardiovascular disease, reduced risk of breast and ovarian cancers. Also, additionally, successful breastfeeding is linked to improved emotional and mental well-being, as well as stronger maternal-infant bonding. As International Board Certified Lactation Consultants, we are very uniquely positioned to support maternal health. We are usually one of the first responders when families make this adjustment in life. While our primary focus is infant feeding, our role extends far beyond that. We assess the whole dyad, both parent and baby, considering physical, emotional, and environmental factors that influence feeding and recovery. Some challenges that we face are most families leave the birthing environment without enough feeding and postpartum support. And I think we've all talked about this across the board. They find that when they're left with their own devices, they lack enough education and support as they begin this journey. Some common challenges are usually include unreal expectations, latching difficulties, pain or trauma, milk supply concerns, and conflicting advice. These obstacles can escalate quickly, causing strain and friction in an already vulnerable family state. Lactation and postpartum support is often under-supported and under-recognized as part of the maternal health team. A lot of providers simply don't know enough about what we offer or how to implement lactation consultants into their team. So here's a little bit about what we do. We provide prenatal education and support, and we love it. It is our favorite when we get to interact with moms before they have the baby and before their emotions are high and before everything has kind of kicked into play. So that prenatal education and support is a key factor. We provide postpartum in-home consultations. We do telehealth visits. A lot of times we are notified from a parent that needs immediate care. So we have found that it has been so convenient if they need immediate care to do a telehealth visit, teach them a couple tips and tricks until we can get a consultant into their home. So those telehealth visits have been really important. Specialized, personalized feeding plans and care. We provide help with preterm and special need babies and mother support. We also help moms pump. Pumping is kind of a new thing that's hit the deck running. A lot of moms are exclusively pumping. So we help provide pumping plans. We also help moms work out a plan to return to work because we have a lot of full-time moms going back to work a lot earlier than we would hope for. We practice doing assessments on baby and mom. We do oral function assessment and latch assessments. We do breast and maternal assessments, and we also help with weaning and the introduction of solids. So we kind of cover a lot of bases. By addressing these areas, we help prevent small challenges from becoming larger health concerns. This is one of my favorite sections, and I know we have really hit home on this, but what our favorite thing as IBCLCs is that collaborative care that we find in our community. We love collaborative care. It's a team-based approach where healthcare providers work together to support the patient. This includes IBCLCs, pediatricians, OB providers, midwives, doulas, mental health professionals, pediatric dentists, body workers, and many more community resources, as we've talked about. I'm super excited about the Family Connect resource that we just heard about earlier. The goal is to provide seamless, consistent, and patient-centered care. As IBCLCs, we communicate feeding assessments with providers. We refer to specialists when concerns arise. We support care plans created by the healthcare team. We advocate for the needs of both mother and baby, and we hope to act as a bridge between clinical care and real-life implementation in the home. We love to build relationships with local providers, and we're always looking for wonderful resources. We're constantly creating referral networks and reliable resources where we can send our clients. We offer consistent education across disciplines, and we increase accessibility through in-home and virtual support. So we kind of hope with all of these strategies that we help ensure that families don't fall through the cracks. Just to finish up, I feel so lucky to be a part of the maternal health industry. I love helping families reach their individual goals and find happiness with this new adventure in their lives. Breezy Babies is a wonderful team of professionals that are continually building their knowledge base to better support families. And I love the team of people that we've met today. I think that this collaborative care is really the secret to helping these moms that we come in contact with. These are just a few resources that I used for those statistics about breastfeeding. So if you have any questions about Breezy Babies, I would love some questions.
We don't have any questions in the chat.
All right, sometimes maybe people are pondering, so we'll have time at the end. Thank you so much, Candace, for providing another perspective. I learned a lot I did not know before. And again, filling an essential role and a gap in the community. Again, nice to hear about the prevention. All of you are talking about upstream work and helping the moms succeed and thrive. So Tina Mikesell is with the Davis Behavioral Health, and she does outpatient treatment and specifically postpartum support groups. So Tina, are you in the call? I didn't see her name on here, so I was wondering if the phone person might be her. Tina, we cannot hear you if you are trying to speak. Okay, maybe she'll hop on in a second, but yeah, so like I mentioned, all of these programs and many more, all of those organizations listed in the Home Visiting Collaborative are in that quick link to maternal health. You'll find some other things that are broader that we did not, maybe not always included, such as fertility grants. I'm trying to think what else is in there that's a little bit unique, but definitely Intermountain has their OBGYN as well as midwives that help out in their facility. And Tina might not have been able to make it, and that just happens, and we roll with it. Any final questions for any of the presenters?
Travis, I have a question for midwives. I'm wondering if they accept insurances. It's probably listed on her website.
Let's see. She may have had to hop off. I don't think I see her anymore on here for Bonnie.
Okay.
But I do know that they charge full cost for their services. It would be on the program card within that quick link. And if it isn't there, then it would be on the website. Yeah, because they list out how much it costs their services. And then Debbie said Tanner Clinic midwives bill most insurances. Betty, by the way, will make sure to add Project Success into that group. And And then Emily had shared more detail in the chat about the number of child developmental screenings, referrals to different programs such as early intervention in Davis Behavioral Health, and others. And she says that many more referrals were made, but those are some of our most common. What's nice about the Davis Links resource directory is that it has that ability for organizations to refer to each other. And that's something that we as a Davis Links admin team have not emphasized yet, but it will be part of the future training, is how do we use this platform to connect with each other and make sure that we're providing more handoffs and wraparound services. And then also Isa with the health department mentioned that Davis County has a Marshallese Moms and Babies work group, and it focused on maternal health for Pacific Islanders. And that is an area of disparities as well for health outcomes for that population. And she also included the link to that report. And then all of that will be shared out. Like I said, this is being recorded, and it'll be put on our Davis Links Resource Forum's YouTube page. But again, expect the follow-up email probably by the end of this week with all that information. Don't see Tina, and that's okay. So like I said, the postpartum support groups are in there in that quick link. And thank you again to our presenters today for sharing different aspects of maternal health and for working together and creating a positive experience for mothers and for children. Like I said, the next month's topic is child care support. So we're going to learn a little bit more from different organizations. Really excited. We have a really amazing main presenter who's going to be talking about, if you've heard of the Policy Project, they are an organization that helps push through important legislative policies over the past few years, and childcare is one of the ties into this year's initiative. So be looking forward to that, and then others as well. So with that, if there's no further questions, we are going to wrap up. Thank you again for those who also asked questions, great questions. And if you have any follow-up, I will be sending out the link to all of our previous and presenters for all of our different forums and their contact information. Okay, thank you everybody. Have a great day. Enjoy the spring break if that applies to you, and I'll see you later.